Hey runners of the wild, first of all I want to apologize that I probably sound a little bit like Kermit the Frog. I've been a little under the weather, but I want to make sure I got my video out to you guys this week, and today we are talking about the knee. First thing we got to talk about when we talk about the knee is, well, first let's talk about a few of the injuries that you may have heard of or may be dealing with. So patellar tendinosis, the catch-all is your patellofemoral syndrome, patellar tracking disorder. We can throw in things like chondromalacia patella, or irritation of that cartilage under your kneecap, IT band syndrome, which not many people think of as a knee injury, but it's usually lateral compression around their IT band and the bursa that lives below it. So any of those things surrounding the knee are things that you may have dealt with or may be dealing with. Maybe you've had acute injuries like meniscus tears or ACL or MCL tears. All those things at the knees, subtract out the acute injuries, are rarely things that are wrong at the knee. So the knee is the guy that lives in the middle of the hip and the ankle, and we always say that the knee is going to do what the ankle allows and the hip tells it to do. So even though you may be dealing with a knee issue, you very rarely have a problem at your knee. When you do have a problem at your knee, it's usually latent. So what that means is I've either had an injury to that knee or I've had an injury somewhere else that's now causing altered mechanics of that knee. So take for example, if I have a really bad lateral ankle sprain, I'm probably going to lose some rotation and maybe some extension of my knee to keep me from loading that ankle like I should, which is going to keep the ankle good. But if that same compensatory movement keeps going after the ankle's better, I may end up with knee problems. So that's where we tend to see things happening at the knee itself. You can probably get away with a lot of altered knee mechanics for quite a while without things going wrong, but we're going to talk more in the next video as we travel up away from the knee through the hip, and we may have to spend 2 videos on kind of the hip itself because of how it's going to dictate function of the knee, but also hip issues itself. So just realize when you got a knee issue, maybe it's nothing wrong with your knee, and I think most people do know that already, but sometimes it's not just as easy as going doing a clamshell or getting your buns of steel, your thigh master out and working out this. Sometimes we got to get a little smarter. So when we're dealing with the knee, and let's say that we're not dealing with the hip today, so we're dealing with knee issues, we really have 3 ranges of motion that we got to make sure are good in the knee, and that would be flexion or bending my knee, extension, and then rotation at your knee. Now I would say rotation is not necessarily the least important, probably the one that we don't worry about as much in rehab world, or just when we're thinking about doing stretches or mobilizations. Things that we do think about, if you've ever had knee surgery, the first thing you want to do is get terminal extension, because that's a really big deal for the health of your knee. Other thing we got to get is full flexion. So I'm going to kind of go through those really quick, and then I'm going to talk about 2 additional things with the knee. So let's run through these ranges of motion. So if you're having some pain in your knee, in particular in the back of your knee, and again, remember on these videos, I'm not diagnosing anything, I'm not treating anything, I'm just maybe giving you some tips to help you out before you go see somebody like myself. Say I'm dealing with pain in the back of my knee, or even pain in like the eyes of my knees. We know if I have what's termed like a derangement in your meniscus, which means irritation, possible tear, whatever it is, that if I can positively load that meniscus and the surrounding tissues, that sometimes I can get rid of pain, which then gives my body a chance to move appropriately, therefore breaking the pain cycle. So getting something behind your knee, and we call this like a nutcracker maneuver, but getting something behind your knee to create what's called a mattress, and then going through some flexions does 2 things. It's creating what's called, I kind of call a hydrodynamic pump. So as I take that knee through terminal flexion, right? So my knee can normally go here, but when I put this behind it, the structures on the front of the knee have to stretch a little more so I get into the anterior capsule, but it also creates this negative pressure system. So as I create a lot of pressure and I let that pressure off, new viscous fluid or new synovial fluid has to flow into the joint. So you're going to carry, hate to say it, bad metabolites out, good metabolites in, but you're basically dousing that joint in new synovial fluid, which does bring new metabolites, new nutrients to that area. It can also act as basically a mechanical anti-inflammatory. If I have swelling in there, I can get some pumping, and maybe that'll help alleviate some swelling, especially in the anterior compartment of the knee. This can also help get terminal flexion back. A lot of people will have knee problems and they get a pinch or they get pain and they can't do it. So now if we create that mattress so they're not going to terminal flexion, we give them about 20 flexions here, all of a sudden they can come back in and flex, and then all we gotta do is use this thing for about a week and we're back. Now, is that really fixing anything? Maybe, maybe not. That would be up to somebody like myself or whoever you're working with to determine that. But easy ways to work on knee flexion. I'm gonna go into knee rotation next because, like I said, this is kind of the redheaded stepchild of knee movement. This is kind of a hard one to appreciate. But if you can see, I'll do my right knee, because some of you, another knee issue you may know with when you were a kid was Osgood-Schlatters, that weird termed knee issue where you get a little traction from your patella tendon on your tibial tuberosity, which mine's really big on my right knee because I had issues here. So if I want to get knee rotation, which my knee is tibia rotation, so it rotates in and it rotates out, I need to work on that because as my foot or my ankle rotates, so should my tibia and so should my hip. And if I lack rotation in any of those areas, I'm going to compensate and get more rotation in the other, which is usually where the problem is going to show up. So let's say I got a stiff knee, you can see things like shin splints showing up on the medial side here, maybe an impingement in the hip. So if I'm working on knee rotation, I put my thigh in a headlock here, and if you watch closely, I'm going to externally rotate, so you can see that little bump moving external, and then I'm going to try to extend my leg as high as I can, and then I'm going to internally rotate, and I'm going to bring it back down. So this is one of those cars that we talked about, the controlled articular rotations. And then I'd switch. So now I'm going to internally rotate, so you can see that moving internal. I'm not letting my leg move. I'm going to extend, now externally rotate, and bring that back down. I may do 3 to 5 of those. But that's a really easy way to start working on active mobility around my knee. Now I'm not going to go through, let's say I do this and I can't get internal or I can't get external. If you want to know how to work on that in particular, you send me a comment, send me a direct message, and I'll help you out with that, but that's a little more in detail. The last one, so knee extension. So I don't know if we'll be able to get this on camera, but if I have terminal knee extension, it should be about 5 degrees of hyperextension. So what that means is when I'm sitting here with my legs flat on the floor, if you can see, I can get my heel up off the ground, right? So that's knee extension. Now, if I did this and it looked like this, and my heel was not coming up off the ground, right? I'm not getting that clearance, I know that I'm not getting full extension of my knee, which is a big deal. And I would say more often than not, knee extension is what's lacking, or that terminal knee extension. And now you're using basically all of the muscles surrounding your knee to always stabilize it instead of being able to lock the knee out. So when I terminally extend my knee, my tibia and my femur rotate on one another and they basically like screw into a locked position. If I can't ever do that, I'm always using those muscles, so that's going to cause an issue. So we use stuff like voodoo floss. This was developed by a guy that basically cut a bike inner tube in half and started wrapping around his leg. So if you got a bike inner tube laying around, you don't have to go buy this stuff. But you would wrap this stuff really tight from distal to proximal up around here. And once we get into that, or get that wrapped up, we would come over to something we can hang on to, or just standing here, and we would basically mobilize, try to push that knee back on 45 nice and gently. Now, the reason we have it wrapped is, you may not realize, or you may realize it, when you go to lock your knee out, you may have some hesitation, whether it's pain, tightness, or just you don't like to do it. By wrapping this thing up really tightly with something like voodoo floss, you basically override that mechanism. So it's not like this is magical, rubber band here. It just overrides some of the proprioceptors around the knee, and now I can get that thing in a terminal extension. We always follow up a passive knee drill with an active knee drill, and my favorite one for extension is getting a band. And this is a heavy-duty band. This is a 40-pound band. And I put it right below the crease of my knee. And that's for a couple reasons. I don't want to occlude any neurovascular structures, and I want to be moving my tibia opposed to my femur to get lockout here. So now I'm going to imagine I'm going to squash a bug under my heel, and then I'm going to extend my knee hard. Now, if I go through 8 to 10 reps of this, your quad is going to start to get on fire. But this is teaching my brain, now that I worked on the passive extension, how to actively get this extension. But this can help a lot, especially if we've had chronic issues. We're starting to get arthritic change in the knee. We've had surgery. We never got terminal extension. These things are important. And it's not so much that we're never getting a terminal extension when we run. And if we do, it's probably not a great thing. That means we probably took a misstep or landed in a hole. What we need all of these ranges of motion for is because when my body can read full flexion, full extension, rotation, my brain gets more feedback and more input. So if I take an awkward step and my knee can pick up all those ranges of motion, it's going to have more feedback to the brain, which keeps everything healthy in my lower extremity. So I hope that makes sense. Again, if you have questions on any one of these or anything in particular, let me know. But we talked a little bit when we went through the calf about self-myofascial release using things like a stick or a foam roller. I'll tell you, the quads are one of the places that I do recommend using a foam roller because we tend to get too much activity of the quad to stabilize the knee. So if I start to get any kind of trigger points through my quads, especially inside or outside here, you can have referred pain down into the knee that's not even, again, a knee problem. It's just pain that's being referred from your quad. So by simply getting in here and doing a little bit of work, and this is not one of everybody's favorite places to work because it's somewhat painful, getting in here and working can alleviate some pain here, but it also may give you an opportunity to get more range of motion because your quad is so restricted. So that is one place that I suggest using some self-myofascial release, whatever tool you want to use. Now, the last thing, say we've worked on some of these ranges of motion that I wasn't so good on. I've done some soft tissue. I'm going to start to train, just like if you remember back to our ankle video, we started to train inversion or supination like this. Well, let's say I've had patellar tendinosis and I'm on the back end of it, so I'm not dealing with the acute pain or the inflammatory state. I want to start eccentrically loading. If you remember, eccentric is lengthening under tension. I want to start eccentrically loading these tissues to basically make them a little more robust and to be able to handle, especially if I'm doing a lot of hill stuff, especially downhill. That's where most people get that acute patellar tendinosis or subpatellar pain if you're going to be a runner, especially a trail runner. So we're going to do what's called a sissy squat. Now you can do this a couple different ways. If you are high level, really flexible, you're not having a lot of pain, you can just do a sissy squat where I'm up on my toes and say I need something to assist me. I'm basically trying to load my knees maximally, and if I was really good, I could go all the way to the ground, and then I'm coming back up. Because what we see in the strength conditioning world is we don't ever want to pass our knees out over our feet. Well, if you want to load your patellar tendon, you want to get your knees out over your feet, but I would never put weight on this, and I'm not doing this fast. I'm doing a very slow, eccentric, controlled squat. Now, if I was really good, I'd go all the way to the ground, touch my knees, come back up. Again, I would never do this if I had pain though either. You're just going to move different, and again, you're going to be stuck in that pain cycle. You can also do this one leg at a time, where we don't have to load the toes. So now I can come as far forward into my ankle as I can. I'm going to try not to use this back leg, and I'm going to try to load this front leg as much as I can, and then I'm going to reverse that. So I'm going to go knee forward first, and then try to stay out of that back leg until that last possible stabilizing point. So two ways to work on kind of a sissy squat or eccentrically loading patellar tendon, but you're also working on the quad together. So that would be that last step, right? So it's always get your mobility in the joint. Maybe you got to do a little muscle work to get there as well, or at least make you feel good after a run, or if you're having some pain. But then we got to start bolstering the system or make you have a more robust system so you can go handle the trails a little bit better. Hope this video helps. I know the knee is really complicated. There's a lot more we could talk about. We'll cover some stuff in the hip video. I'm probably going to do 2 videos on the hip, one directed more at how the hip can dictate function at the knee, and then one on hip issues itself. If you guys have any questions, comments, please let me know. Thanks again for listening, and I apologize for the cold. See you guys next time.